So let's say this is the BRAC1 protein. So between 200 and 300, there is NLS. So if we were to cut out between 250 and 290, then it's gonna mess with the NLS here. So what's gonna happen is one of the things that BRCA1 does is it helps repair DNA, and it also helps with replication and everything. So what's gonna happen is, if say this is the nucleus, then there's a protein here. Then in order for the BRCA1 protein to be able to go to the nucleus, the NLS has to bind with the protein receptor here. But if there's no NLS, or if it's rendered, then it won't be able to bind here, and hence it won't be able to pass through the nuclear pore. So if it doesn't pass through the nuclear pore, what happens is DNA replication won't occur. So if DNA replication doesn't occur, then not even the replication, there's also DNA repair. If that doesn't occur, then what's gonna happen is it's gonna lead to mutation. So if it leads to mutation, then it's most likely it might also cause like cancer and other things. So now I'm gonna go to question 2. So for the second question, the question is, what happens if exon 1 is cut out, I think. So, and exon 5. So exon 5 is a ligand binding. So let's draw this. Say this is the LDLR. So the LDL receptor here. So what's gonna happen here is, in a normal function, LDL, which is containing cholesterol, would come here and bind here, and then it will be able to go through the cell. But if there is a mutation or something occurring to the LDLR, then the shape would change or wouldn't exist at all. So if the shape changes, for example, if it's like this, when it's supposed to be like this, then this will not be able to bind to this. So if it doesn't bind, what's gonna happen is it won't be able to go through the cell. So if it doesn't go through the cell, then this is gonna stay in the blood. And at some point, there's gonna be a lot of them in the bloodstream, causing a lot of cholesterol to stay in the blood. So if a lot of and it won't be able, when it goes in, what happens is a receptor mediated endocytosis. So that process would not be able to occur. If that process doesn't occur, like I said before, there a lot of like LDL will stay in the bloodstream. And so if you go to the doctor, he'll probably tell you that you have cholesterolemia. Wait, let me do something. Yeah. So that'll be it. Thank you.